there's a couple of key areas here that are related. So just around here are where the adrenals are going to be. So your true adrenal points are here. Okay, they're just literally above the kidney. So you basically follow the ribs down and you're going to get into that area. If you've got pain here in your back, okay, and there, yeah. Okay. So that's your right adrenal. So that's going to be pain that's caused by a male, most likely. Okay.
Yep.
And you'll probably also have symptoms here in the right.
Yeah, that
muscle
feels like
piriformis. They go together. The saying that someone's a pain in the ass actually comes from them really being a pain in the ass. We would normally release them with usually a massage tool. So we get on there and actually just release the tension around there with a massage tool. And if it's left side, so if you've got a woman driving you crazy and making you feel really stressed, be left side. Now, if you've already got endometriosis, that could be you. What we can teach you to do is you can use a pair of tennis balls and you can put those and lay on them. So you lay on those on the floor and roll around gently, flat on your back, so those would massage you there. As well as that, this area here is called the heart chakra. Now that's the emotional centre for your body. So if you're grieving the loss of a relationship or the loss of someone, or anything that would upset you at that level, these muscles all in here respond to that. Right hand side male, left hand side female. So tennis balls would be up here, doing that. Adrenals here, reduce your estrone. Here and here for communication, for pain in the butt. So if you suspect that you have chronic pelvic pain, one of the things you can do just to check, and this is what we would do to check, would be you can palpate here. Palpate means just to squeeze. So you're going to squeeze hard enough that if you were squeezing, you would be able to squeeze a crisp apple and feel like you're pushing into the skin of it. So it's that much pressure. Now, with someone who's got chronic pelvic pain, as you do this, they will describe it as feeling like broken glass being pushed into their legs.
It's very sharp.
It's a very sharp pain. So if you find one side is tighter than the other, and you've got pressure more on one point, so like there than there, and then this one you've got more pressure there, if that's consistent up one side of the leg, then you know that that's where the kinetic load has gone. So the path of the load has been pushed all the way up one side. You're more likely to have contractures on that side or that side, depending on which leg is in the most pain. I talked to you earlier on about using what we call Raro Technique, which is the technique I learned from the Pacific Island lady. Now, we've modified it, and the only thing I'd say to you is that getting the pressure right is a little bit difficult. You've got to get the pressure right, and it needs to be done in one specific move. So from a therapist position, I need to be really stable because you need to be able to trust what I'm doing. Nothing's done too fast. And so I slide through here, and as constant as I can. Those same lines I went up when I was pressing before to test, I now do in one smooth move. So there, and you can tell.
It feels really nice, but I remember the first time you did it to me, I was screaming.
Yeah,
It was
and
so painful.
When you do it with someone who's got the condition the first time through, this is just unbelievable pain.
I couldn't believe how, it's getting sore.
It's a little bit there, and I can feel that resistance through my thumbs. And then I'm coming in either side of the uterus there, and there's a little bit of tension on the right hand side there, okay, which we can feel. So I'm just going to hold there and breathe and relax. Okay, so we talked before about the emotional content and those engrams, those patterns of muscle behaviour. So here, if you have tension in this muscle here in the lower ab, that's where you feel guilty. As I go in there, you can feel it's got that sick, that's not fun feeling. Then on this side, that's where you feel fear, so it's sharper.
Yeah.
You can feel that it's quite a bit sharper. And then right up here, these two here are where you get anxiety. Now, what's interesting about those two is directly underneath them sits the esophageal valve at the top of the stomach. So if they're pulled over and squashed by these being compressed, that valve gets tight and you end up with reflux a lot and you can't stop it.
Yep.
Once you get that those undone, okay, that stops. Clearly those ones would have the impact of putting pressure down on the lower abdominal quadrants, so you're going to be looking at putting pressure on the intestine and bowel, but also on the uterus because you're compressing that whole area down there. Now you can do that either manually with, and we use a tool, a massage tool, so we'd release it with a massage tool and release that tension, and you can feel it as you go in, when you go in, and so you can do that, or you can do that with tennis balls. If you're going to do it with tennis balls, there's a couple of things you need to know. One is, if you're going to do it, the upper ones here, you need to have the ball about half a ball apart because there's an artery runs through here that needs to be able to keep pumping. Okay, and if you're going to do these, they're a bit wider, and you can roll on those and just lay there. If you've got chronic period pain, put them down here next to the uterus and just lay on them. You don't have to move. You can just lay on them, lay still, and that will gently release. If you put a hottie on it, you're just going to cook it back in place. It'll be okay for now, but as it cools off, it's going to be worse than it ever was, and your next cycle will be worse. Try this and see. Your next cycle is better and easier each time. Okay? So that's the areas we'd do, and they would be the last areas we would do in this treatment. Okay? And that would mean that this whole cavity here and the web of muscles that travel across it from both sides and then all down the front of it and right around it, you've got a big one transversus like a belt, they're all released. They take pressure off the peritoneum and the endometrial cavity. It all goes back and it looks after itself. Once you take the pressure off, it will normalise, it'll go back to homeostasis. It'll stop screaming for hormones, it'll stop screaming for proteoglycans to be flooded in there, and it'll all relax and you will recover.